You're watching the Emmy Award-winning Richard French live, only on RNN.
Meeting the health needs of our senior citizens is a problem that touches every child, every parent, every grandparent. It is casting a shadow over the lives of 3 generations of Americans.
This is the cause of my life, new hope, that we will break the old gridlock and guarantee that every American, north, south, east, west, young, old, will have decent, quality health care as a fundamental right and not a privilege.
Those 2 statements, the bookends, to Senator Ted Kennedy, separated by more than 40 years, but both of them could have been said just yesterday. With nearly 50 million Americans without health insurance in this country, we're now further from Kennedy's dream of an affordable health care plan for all than seemingly we've ever been. The debate over reform, it has suffered from his absence. Now, instead of the critical discussions we ought to be having on how best to provide affordable health care coverage, we are drowning instead in this.
No, we can't! No, we can't! Shame on you with that! Shame on you with that! You didn't speak!
This, the scene in Northern Virginia yesterday, as a crowd of angry, scared, and misinformed protesters, led by anti-abortion zealot Randall Terry, they shouted down both Congressman Jim Moran and Howard Dean.
Dispel the myths, inform the constituents, try to hear from them so that we have a good sense of where at least my constituency stands on this critical issue.
A lot of this debate is about change. And the one thing that any doctor can tell you about change is that you never make real changes until the pain of staying the same exceeds the fear of change.
But fear of change is a powerful motivator to ignore the facts and just refuse to listen, especially when you got extremists like Terry pleading the parade. Now, then there is the GOP, which some Democrats in the Senate still think are open to the idea of bipartisanship. Let me give a reality check. That ship, it sailed a long time ago. Republicans in the Senate are now so locked into their opposition of anything even smelling of government that Senator Tom Coburn, he set a new record for irony here when one of his constituents told him an all too familiar story of being betrayed, in fact, by her health insurance. Just take a listen for yourself.
Senator Coburn, we need help. My husband has traumatic brain injury. His health insurance will not cover him to eat and drink. And what I need to know is, are you going to help him where he can eat and drink? We left the nursing home and they told us we're on our own.
First of all, yeah, we'll help. The first thing we'll do is see what we can do individually to help you through our office. But the other thing that's missing in this debate is us as neighbors helping people that need our help. We tend to the idea that the government is the solution to our problems is a very inaccurate statement.
Okay, here's the thing. Senator Coburn, notice I said Senator Coburn, you are the government. The fact that this guy can promise to help this woman with one side of his mouth, then bash the government intervention in healthcare with the other, shows that the grand old party is still the party of no on any meaningful healthcare reform, especially if they want to help that woman out. But the Republican high command, they believe they can have cover on this as long as right-wing blowhards just keep moving the healthcare debate away from discussing any real meaningful healthcare and towards ridiculous claims like death books, illegal immigrants, as well as the president's own race.
He just wants us to have the same health care and plan that he had in Kenya. And look, economic anxiety is necessary if you want to become the next black FDR.
Okay. First of all, Rush, at this point, I think FDR sounds pretty good. But here's the real tragedy. Lost in all the town hall shouting and the Limbaugh idiocy is what's actually happening to healthcare reform during the August recess. The so-called Gang of Six in the Senate Finance Committee, They appear to be setting the agenda for a reform bill that could overcome a Republican filibuster, and they just hate the idea of a public insurance option that would compete directly with private insurance companies. That may have something to do with how much these senators have actually received in contributions from those health insurance and big drug companies, especially for the group's ringleader, Max Baucus. Baucus was a conservative Democrat. He's been at the forefront of calls to drop the public option and replace it with some form of a co-op or subsidy program. He's also received, just so coincidentally possibly, more than $1 million in campaign contributions from the same folks responsible for this healthcare crisis we find ourselves in. Now here's where the dots start to connect. The Baucus bill, it would still require every American to get insurance, but with no public option, the only place to get the insurance are from the big private insurance firms, the government that pays them billions to expand their coverage programs. Thus, we're returning healthcare reform into a bailout for an industry that is making record billion-dollar profits as we speak. And as if it needed it, here's the real kicker. The Baucus plan, it will not require one iota from the insurance industry to either reduce costs or improve the quality of their coverage. I think it's all what we can agree reform we cannot believe in. Now, this is not the reform that Ted Kennedy devoted his life to. I think I'm on safe ground there. So if Congress decides to name healthcare reform after him, it had better reflect his ideals and not be just a Trojan horse for an insurance industry bailout. All right, when we come back, we're going to have more of your reaction to last night's topic, the investigation into CIA prisoner abuse. We'll have that, plus an update on the story right after this quick commercial break.